I'm Dr. Paul Lieber. I'm going to begin in a few minutes with the webinar. Hopefully you can see me and you can hear me, and we'll get started. Anyhow, the interesting thought had a relationship to the movie Pretty Woman and the end of the movie. So this has a lot to do with me and maybe a lot to do with you. So here we go. Taking a little while to load. I'm not sure whether you can hear the audio, but basically, this is the end of Pretty Woman, and they're saying, what's your dream? And well, I wanted to talk a little bit about my dream, and then we'll talk about your dreams. So my dream, if you can see to the right of the screen, this is an alpine mountain called the Col de Nivelette. It climbs up to 9,300 feet. I'm an avid cyclist, and this was my dream, my bucket list to climb the Alps. Unfortunately, in May of 2018, my dream was interrupted. We were planning to go to ride the Alps that summer, and I had developed tibialis posterior tendonitis in my foot. I had a PRP treatment, and I stupidly stepped on a sharp object in the middle of the night and ruptured my tibialis posterior tendon. So I went to see a surgeon because I was told that surgery would probably be necessary to reconstruct a tendon. And what they offered me was to transfer a tendon from the flexor digitorum longus and attach it to my tibialis posterior. Then they would do what's called a calcaneal osteotomy, where they would cut my heel bone and move it over and re-screw it in place. And then for good measure, down at the bottom, they would cut my gastrosoleus muscle in the back to give me some extra lengthening to help make this work better. They told me that it would be 3 months of non-weight-bearing status and a full year to recovery. And the complication rate was 22%. And the surgeon told me without surgery, I was doomed to wear a Arizona brace, which is the brace, the black lace-up brace, full-time for the rest of my life. Well, in July of 2022, I fulfilled my dream. The top is climbing an Alpine pass with my brother and a guide. The bottom is crossing the top of the Col de Nivelette with my brother. I had bone marrow concentrate containing my own stem cells to both my left knee and ankle in 2018. I put in a lot of rehab and hard work. I don't wear a brace, but I have good shoe inserts, and I'm feeling good and so happy to have avoided surgery, which I think would have ruined my foot. This is me riding a bike. I am obviously a Regenix patient, and I'm board certified in several specialties, including physical medicine and rehabilitation, electrodiagnostic medicine, pain medicine, and interventional orthopedics. And these are my colleagues, Dr. Adelsheimer on the left and Dr. Sally on the right. We have 3 locations, our main location in Pittsburgh, secondary locations in Bridgeville and Washington, Pennsylvania. And we're all board certified in physical medicine rehab. Dr. Sally is board certified in sports medicine, and Dr. Adelsheimer in interventional pain medicine. So in this webinar, I'm going to show you our 3-step process of treatment where we get your cells, how they work, what they can help, and answer your questions. So who is this for? Why are you here? Well, really, what are your dreams? What are your aspirations? What are the things that you're not able to do right now that you want to do? Do you recall enjoyment and fulfilling activities that you can't do any longer because you're in pain? You want to avoid surgery. You'd like to keep all your body parts, and you don't have time for a lengthy downtime or rehab. You're tired of taking drugs. Some of you possibly have failed surgery before, or you know somebody who had a bad outcome. You may have a medical contraindication to surgery, or you're too young for surgery. Maybe you're too old for surgery. So we treat more areas of the body than any other regenerative treatment option in the tri-state area. As you can see, we treat spine, degenerative discs, spinal stenosis, post-surgical fusions, herniated discs. We treat primarily knees, hips, and shoulders. We can treat anterior and posterior cruciate ligament tears, severe arthritis. We treat tennis elbow, golfer's elbow, CMC of the thumb. We treat ankles and feet. In short, we treat everything from the top of the spine, where your head meets the top of the spine, to your big toe, inclusively. Well, let me talk a little bit about Regenx. We're a highly selective physician network with proprietary high-dose protocols. We're the world's leader in research and development, and we have a nationally self-funded employer practice. The specialty of interventional orthopedics is what I practice now. It's less invasive new medical specialty than surgery. We use orthobiologic delivery by injection. These are your stem cells and your platelets. And there's a much lower risk to treating you with needles rather than scalpels and saws. Regenx began in 2005 in Broomfield, Colorado, outside Denver. They have the most experience in the orthobiologic field. We joined Regenx in 2012, and we were their 6th affiliate. We're one of their biggest affiliates in the country, and they now have 75 affiliates worldwide. Let's talk about what matters. Physician expertise matters. At Regenx, we've completed over 3,000 stem cell procedures and 12,000 PRP procedures since 2012. We're physician experts holding board certification in physical medicine rehab, interventional pain, and sports medicine. We're all master certified through the Interventional Orthobiologic Foundation, which is the teaching arm of Regenx. We go out there and we train and retrain several times a year to get better and better and better. We are physicians focused on your care. We are not physicians extenders. We don't use physicians extenders like PAs or nurse practitioners. We're not a chiropractor or a naturopath. You get well-trained, expert physician interventional orthopedic specialist. Diagnosis matters. You need a physician to make the correct diagnosis in order to perform the correct treatment. If you aren't a specially trained musculoskeletal physician, you'll miss the diagnosis a third of the time and perform the wrong treatment just as often. Image guidance matters. We use ultrasound guidance and fluoroscopy, which is an X-ray machine that tilts in space. Why do we do this? Because we want to most precisely place the orthobiologics into the site of injury or degeneration. And we do this with image guidance and needles. We provide comprehensive treatment of joints, tendons, ligaments, and bone. This is the most effective way to enhance healing, reduce pain, and restore function. We're not closing our eyes and direct a needle in blindly. We know exactly where the needle needs to go based upon the clinical exam, the diagnostic studies that we review with you. Cell types matter. MSCs, mesenchymal stem cells derived from bone marrow, are FDA compliant. The FDA considers illegal the adipose washed with collagenase, so fat cells washed with an enzyme. The FDA considers making a drug, and the FDA considers illegal commercial products containing placenta, amniotic tissue, cord blood, Wharton's jelly. These are tissues, they have no cells, and the FDA has gone after these companies. Dose matters. One size doesn't fit all. We use a laboratory in our office rather than the bedside centrifuge. We can concentrate your platelets and your stem cells to a much higher level. And we realize that specialized dosing is important for individualized treatment. A 13-year-old who's torn their anterior cruciate ligament requires different cell dosing than an 80-year-old who has bone-on-bone knee joint arthritis. Tendons, ligaments, and joints all require specific doses for optimal healing. Safety matters. Regenexx has the largest safety paper in the world, 2,500 patients. We found that the treatments are extremely safe. The most common complication was pain at the injection site. They could last for 1 to 3 days. Very low risk for complications. Again, we're using needles, not scalpels, and we use guidance with fluoroscopy and ultrasound. At Regenexx Pittsburgh, we have a 0 infection rate, and we like to create a scenario where you have the least pain possible. Research matters. Regenexx has completed 40% of the research on stem cells in the world. We have a registry of 35,000 patients. We know how they've done. We know what works. We know what doesn't work as well as we'd like it to work. And we continually strive to make the treatment that we do better for you. So what doesn't matter? Weight doesn't matter. It's been shown in knee osteoarthritis that it doesn't matter how heavy you are or how thin you are. It's not a factor affecting your knee arthritis outcome with Regenexx bone marrow concentrate containing your own stem cells. People who are large or obese are often eliminated from surgery because of their weight, but they're still good candidates for the Regenexx procedures. Age doesn't matter. And this is a common theme that they said my stem cells were too old. Well, it's actually nonsense. We have less stem cells as we age, but stem cells work very, very well, even into the advanced elderly. We've treated people up to 99 years of age with good outcomes. There are plenty of cells to treat one large joint, and we do this all the time with the elderly. The degree of osteoarthritis doesn't matter. Bone-on-bone arthritis is what we often treat. It doesn't matter that your arthritis is severe. We can give you a good outcome by changing the internal environment in your joint with bone marrow concentrate containing your own stem cells. And this works for years and years and years. Interestingly, 87% of the people who were told that they need a total knee joint replacement didn't undergo joint replacement after receiving the Regenexx stem cell treatment. So let's talk a little bit about platelet-rich plasma, because this comes from your blood, although it can also come from your bone marrow concentrate. It has growth factors and other things that amplify healing. Think of PRP like an espresso shot for local repair of cells. It makes the area that's damaged work harder and longer to get the job done to repair the tissue. Stem cells from your bone marrow concentrate act as general contractors to orchestrate the repair job. They tell other cells what to do to repair the damage. They work well with the PRP growth factors. They work synergistically, and the cells themselves can turn into bricks and mortar. They can turn into bone, ligament, tendons, and cartilage to replace the needed cells where they're damaged. So which one's for you? PRP is generally for smaller joints that are less severe: ligaments, tendons, and spine. Bone marrow concentrate containing your stem cells for larger joints, more damage, more severe injury, and bone damage. 80% of what we do is platelet-rich plasma treatment, 20% are stem cells and platelet-rich plasma. There's a significant cost difference here, and not everyone needs stem cells. So it's important at this time to look at, let's let the body heal itself. The body is capable of healing. One of the instances where this is quite apparent is meniscal surgery. 95% of the meniscal surgery remove the needed meniscus spacer, creating stress risers within the joint that accelerate arthritis, leading to a joint replacement. So if we stop cutting things out and inject orthobiologic agents, people are going to do much better by healing tissue. So with Regenx, as you can see, this person had bilateral anterior cruciate ligament repairs. They went into one site. There are little Band-Aids, no scalpel scars, no sutures. There's less downtime as a result, a shorter rehab, fewer drugs, and you're back to work in days, not weeks. And most of the time, you're awake for all of these procedures. We numb you up well so you feel next to nothing or nothing. So are you a good candidate? Most people are, but if you look like the Leaning Tower of Pisa, if your knee is like that, probably not. We can't straighten out a knee that's bent over, though it's been shown that we can straighten a knee somewhat with the stem cell treatment that we offer. If you're generally sick and have what we refer to as a metabolic syndrome, recent cancer, you can't get off steroids, your condition is too far gone, or you have arthritis all over your body, you may not be a good candidate for the Regenx treatments. So how do we do this? Well, the first thing we do is the pre-injection, where we quote unquote till the soil. We stimulate the inflammation immune response in your body to get the area ready for stem cells. It's much like electrostatic painting, where the joint is prepared to have the stem cells attached to it. The heightened immune response prepares the site to take full advantage of the stem cell injections. And this is usually done 2 to 4 days before the main planting the seeds treatment. Takes about a half an hour under ultrasound guidance. Then the bone marrow concentrate injection, where we get your stem cells from your bone marrow. We're planting the seeds. We do a bone marrow aspiration from your posterior pelvis. Generally, the pain is rated as 3 to 4 out of 10. We take it to our lab for processing and re-inject 2 hours later. So this is just an example of what it's like. This is my partner, Dr. Adelsheimer, doing the procedure, and he's placing a little drill bit under ultrasound. You can see the ultrasound in front of the patient. You can see she's not flinching. This is the posterior pelvis. We use a skinny high-speed drill, and you're in. And that's all there is to it. So it's very simple, generally painless, and gets the job done. So last of the 3-part treatments is to fertilize the stem cells 2 to 4 days after the stem cell injection. We take more platelet-rich plasma from your blood and inject it. It's a simple blood draw, lab processing, and re-injection. And then you go home. Oftentimes you go back to work the next day. And this is what happens. This is Julie, who had been on crutches for 3 years and was able to get rid of her crutches in March of 2014. She had a big hole in her knee where there was dead bone, and it was filled in with bone marrow concentrate containing her own stem cells. And though it didn't fully go away by September 2015, she had no pain. She got her life back. She was able to enjoy her life again. It improved her finances, it improved her fitness, it improved her relationships. So what are the next steps? There's no referral necessary if you can gather imaging, your MRIs, your x-rays, whatever you have, bring them to us. We like to look at pictures and go over them with you. Call the Regenetics liaison, Sarah Furlan. Her number will be coming up. Go to an appointment or a telemedicine appointment. We'll go over your condition with you fully, get imaging if you haven't had it before the visit. We'll prescribe x-rays, MRIs. And if you're a candidate, you'll get treatment. You can rehab at home or have physical therapy, and you get back to your life. First step, make an appointment. We're all local doctors. We're Pittsburghers. We're all specialists in interventional orthopedics. We hold several board certification. We have optimal training, and we continue to train to get better and better and better at what we do so that you get a better result. And we'll use imaging at the time of your appointment, usually ultrasound imaging. You're going to come and get an exam. It's an extended exam. We'll examine you from stem to stern because sometimes when the knee joint hurts, it's actually a back problem. Sometimes when your neck hurts, it's actually a shoulder problem or a combination thereof. So we'll examine you. We'll look at your images. We'll talk with you. We'll pull out an ultrasound machine and show you what it looks like. And we'll make a diagnosis and you'll get your questions answered. We spend an hour with you. What doctor does that anymore? It's next to impossible to get a doctor to spend that kind of time with you. So get your treatment. There's little to no rehab, minimal to no pain meds, minimal to no missed time. You get your life back sooner rather than later. So don't wait. Take your health off hold, avoid the surgery backlog and worsening of your condition, get your fitness and weight back, increase the quality of time with loved ones, get off your drugs, and no one is getting any younger. I remember seeing a patient who was one of those leaning Tower of Pisa knees that I showed you before, and she didn't opt to have treatment. She was at the edge of what was acceptable in terms of curvature of her knee. And I saw her 6 months later, and her toppling knee had advanced to the point where she was no longer a good candidate. Financial information, consultation, the follow-ups, the diagnostics, the bracing, and the therapy are covered by your insurance. So when we see you, we spend an hour with you, that is typically paid by your insurance company, less your co-pays and deductibles. Insurance doesn't cover the regenerative procedures, the prolotherapy, the platelet-rich plasma, the platelet lysate, and the stem cells. You have to understand that with co-pays, deductibles, lost productivity, you may actually be saving more money than you would for a traditional orthopedic surgery. And remember, all the treatment plans are customized. One size doesn't fit all, and the prices vary based upon what we recommend for treatment. So the next step is to schedule a new patient exam. Contact Sarah Furlan to schedule an in-house or video consultation. There's our local number. I think there was another number on the screen, but this will get you to Sarah Furlan, who is our RegenX liaison. So avoid surgery, reduce the downtime, get your life back, fulfill your dreams. What do you want to be doing that you're not doing because you hurt? We can help with the problems that you're having. We're not going to put Band-Aids on it with cortisone that's going to tear down your bones and stop your cartilage cells from producing cartilage and damage you worse in the long run. This is repair. This is not surgery. This is to get you to heal. You have the power within your body to heal musculoskeletal tissue, and we have the expertise to make that happen. So thank you all for listening. I am now going to try to pull up and the question I have is whether anybody has any questions. There we go. All right, let's see. I see you've raised your hand. I don't know if I can, I'll try to answer your, hit that. I don't know if that's going to work. You may have to type your question. Go ahead and type your question, because I can't answer it without your typing the question. So please go ahead. I'll stick around and answer any and all questions that you might have. I see that there are a lot of questions. Somehow I'm not retrieving the questions. I will try to do so. There we go. Okay. First question. I've been to a chiropractor and tried PT, and chronic low back pain does not go away. Can you do anything for me? So the answer is most likely yes. First, chronic low back pain is something that is descriptive, but it's not diagnostic. So we would need to see you and diagnose your problem in order to help you. In other words, is it arthritis in the joints in your spine? Is your disc injured? Do you have sciatica? Do you have spinal stenosis? These are all things that I would need to be able to evaluate you, but most likely we can help you with your spinal condition. We help about 80% of people who have low back problems who've not been responsive to anything else. So ballpark cost of the knee bone on bone. If we're using stem cells from your posterior pelvis bone marrow concentrate, then the cost of the 3-part treatment is somewhere in the neighborhood of $7,500 to as much as $10,000. It's expensive, but you're getting a great treatment and a lot of treatment to get you to avoid a knee surgery. You keep your parts, and this should last for years and years. So Jacqueline says, thanks for the information. I have an appointment in June and looking forward to this. Great, we're looking forward to seeing you. Anonymous, does age of injury matter to success? I would say generally not, with the exception of two things. One is rotator cuff tear, where over the course of time, when the muscle separates from the tendon, the muscle belly retracts, and the separation can be too great to repair it. And the same is true with an anterior or posterior cruciate ligament tear. Over the course of time, the separation increases, and it's difficult to treat those tissues when they've separated significantly. James asks, what is your success rate? Most things, probably spine works the best. It's about 80%. The rest of the joints are about 70%. And hips in the elderly are around 33% if your mobility of the hip joint is reduced and your arthritis is end stage. So another question, I've been to chiropractor, tried PT, chronic low back pain does not go away. Can you do anything for me? So again, I believe that we can help, but we'll need to see you to make a diagnosis. Next question. How does this treatment tighten a ligament that is loose? So by putting I'm not sure if you're able to hear me at this point. So by putting growth factor on ligaments or stem cells on ligaments, they will tighten up over the course of time. We've done this with lots of people with hypermobility syndrome or Ehlers-Danlos. looking to see if there are other questions. Okay, great. I'm glad you can hear me. I'd be glad to answer any more questions if you have them. And I talked to some fellow the other night. I was on the radio talk show and with Dr. Adelsheimer and Rob Pratt on KDKA. And the fellow asked me about Ehlers-Danlos syndrome, which we treat. And by applying platelet-rich plasma or stem cells to the ligaments, the area tightens up. The growth factors repair the stretched ligaments, basically, what's occurring. And he also asked about something called POTS syndrome. And POTS is change in blood pressure so that your blood pressure drops precipitously. And oftentimes POTS is an indication of ligamentous laxity in the upper cervical spine. And that too can be treated with platelet-rich plasma or stem cells. So I'll be glad to answer more questions. I'm here. You have my undivided attention. So fire away. All right, well, it seems like I've answered your questions. If you have more questions, please raise them with Sarah Ferlin. I would be happy to see you. I think that we have the most expertise to treat your problems with tendons, ligaments, joints. Discs, nerves, etc. So James asked, does the extraction of stem cells from your own bone marrow affect your immunity? It's never been shown to affect immunity. We don't take, obviously, we take a certain amount of stem cells, but we don't, we take them in proportion to your hemoglobin, hematocrit, and your weight. And they regrow in a month. So all of your stem cells are regrown within a month. But I would say that we're taking a small amount of bone marrow compared to the amount of bone marrow that you have available. So I've never had anybody have an issue with immunity following a bone marrow aspiration. So hope that answers your question. Anyhow, we would be happy to see you. We have a great deal of expertise between the three doctors. We do the same treatments. We're all master's level certified through the Interventional Orthobiologic Foundation. So we've taken all of the courses available, and we continue to go back and take more courses through Regenix and the IOF. So you get to spend an hour with a physician. We think that we're have a high degree of integrity. And the other thing that's important to understand with respect to Regenix is we have a self-insured employer-employee program. And we're the only one in the country to have that. So employers around the country trust us to provide treatment to their employees. And that's also saying a lot. So you have a bastion of expertise here in Pittsburgh, and we would like to make you pain reduced, pain-free, and fully functional to the extent that you wish to be functional. So with that, I wish you all a good night. Hope you've enjoyed my presentation, and I'll see you in a couple months. Take care.